Today we will discuss thyroid examination steps. If the examiner commands you to examine the thyroid, you will approach the patient by greeting, and then you will introduce yourself, tell the patient your name, and then ask patient name, and then take consent to examine the throat of the patient. Then make proper exposure, and it is very important to have the exposure of full neck, and lower exposure is up to the clavicles, so that you can easily expose and you can easily examine the thyroid and the neck. And then you will ask the patient to count from 1 to 5. So in this way you will assess the hoarseness in voice, and then ask the patient to deeply breathe. So in this way you can check the stridor, and then ask the patient for deglutition, and then and tongue protrusion, and in this way you can see the thyroid movement. And then ask the patient for valsalva and cough. In this way, if any other swelling is present there, it will be prominent. Okay, in after these steps you will start with the inspection from the front, in which you will see the neck, whether there are any previous scar mark, any other swelling, and the extent of thyroid swelling, whether it is extending from one sternocleidomastoid to the other sternocleidomastoid, it is whether it is reaching up to the sternal notch and its upper and lower limit. And you will all comment on all these by inspection. And then start with palpation, in which you will check the temperature and tenderness, then measure the size of the swelling by inches tape. Then by palpation, see the consistency, palpate the consistency, margins, surface mobility, and then do the skin pinch for attachment to the skin, and also see the mobility of the thyroid to the underlying structures. After that, auscultate the swelling for any bruit. And then there are too many important steps, which are trachea and laryngeal crepitus. You will check the trachea position, and check whether laryngeal crepitus is present or not. And the other test which is very important is Pemberton sign and eye signs, eye movements. Then you will see the hands of the patient for any tremors. You can put any card on the back of the hand to see the movement, whether there are any tremors present or not. And after that you will do indirect laryngoscopy. You will also inspect the thyroid from behind, and palpate the thyroid from behind, check the proptosis from the behind. And after that, check the lymph nodes, neck lymph nodes, whether any neck lymph nodes are palpable or not. And then you will see the ankle jerk and pretibial mixed edema. In the last, you will check the pretibial mixed edema, which is present in hypothyroidism. Okay, and then you will redrape the patient and say thanks. So these are the basic main steps which are required in every thyroid examination.